Stand up right now. Go ahead. I'll wait for you. Now, pay attention to how your body feels in this moment. Do you notice any aches, stiffness, or perhaps an unusual sense of fatigue? A lot of people simply ignore these sensations without giving them a second thought. But what if I told you that some of the most serious and dangerous health issues don't announce themselves loudly? They whisper so softly that they're almost impossible to hear until it's much tougher to step in and address them effectively. And one of the most lethal of these quiet whispers often originates from your pancreas, that small yet incredibly important organ positioned right behind your stomach. I'm doctor for more than 25 years. I've dedicated my practice to caring for adults over the age of 60. Time after time, I've observed that while aging certainly accounts for many physical changes we experience, it doesn't explain every single one of them. Far too often, serious medical conditions cleverly mask themselves as nothing more than the ordinary effects of growing older. Pancreatic cancer is a particularly striking and dangerous example of this kind of disguise. It starts so silently, presenting subtle hints that are remarkably easy to brush aside or explain away as unimportant. Most individuals believe pancreatic cancer shows up abruptly, with intense dramatic pain or very obvious warning signs. But the truth is quite different. In most cases, it develops slowly over the course of several months, making itself known through very understated clues. These can include unexplained weight loss that creeps up without warning, mild but constant discomfort in the back, slight yet persistent shifts in digestion, or new difficulties in keeping blood sugar levels stable. Taken individually, each of these might appear trivial, everyday, or simply a normal part of the aging process. However, when several of them begin to appear at the same time and form a clear pattern, they send a signal that really shouldn't be ignored. Over the next 20 minutes or so, I'll guide you step by step through the 6-step early protocol that I've created and continually refined in my practice. This approach is designed specifically for identifying these early pancreatic warning signs, and it draws directly from well-established research and clinical knowledge from leading institutions such as Johns Hopkins, the Mayo Clinic, and the Cleveland Clinic. My goal here is not to frighten anyone. Instead, it's to help build real, practical awareness, so you know exactly when it's time to pay closer attention, when your body's subtle and understated messages truly merit follow-up, and when to take timely action. Before we go any further, please leave a quick comment below with just your age. It gives me a better idea of who's listening right now, and it lets me tailor future information to better suit different age groups. Let's begin by clearly explaining what's actually taking place inside your body, something that unfortunately doesn't get explained in plain, straightforward language often enough. As people enter their 60s, 70s, and beyond, the pancreas undergoes natural, gradual changes. The production of digestive enzymes can slowly decrease, and the way insulin works to regulate blood sugar may become less reliable or efficient. These shifts can start influencing appetite, overall energy, and the ability to maintain a steady weight well before any unmistakable symptoms become apparent. Think of your digestive system as a bustling kitchen that's gradually losing its experienced staff members one at a time. When the output of those crucial digestive enzymes, responsible for properly breaking down fats, proteins, and carbohydrates, begins to decline, food doesn't get processed as completely or effectively as it used to. Even if you're consuming the same quantities and kinds of food, your body absorbs fewer nutrients and calories. The outcome is frequently a slow, truly unexplained drop in weight that surprises both you and the people around you. You might find your clothes fitting more loosely at the waist or across the chest. Sometimes family members or friends notice and comment on it before you even fully realize what's happening. A study conducted by researchers at Johns Hopkins, which tracked 1,500 adults aged 65 and older, found that those exhibiting early signs of pancreatic changes often lost between 7% and 10% of their body weight in as little as 6 months, without any deliberate changes to their diet, exercise routine, or daily habits. You could easily convince yourself that you've simply been eating a little less recently, or that you feel satisfied with smaller portions, so it's tempting to label it as just part of getting older. Yet persistent, unexplained weight loss of this nature always calls for a closer examination and an open conversation with your physician. One aspect that causes confusion for so many people is the nature of pain related to pancreatic problems. It's rarely sharp, sudden, or intensely dramatic. More commonly, it's a dull, persistent, low-level ache situated in the upper abdomen or spreading to the middle of the back. Plenty of older adults naturally link this kind of ongoing discomfort to things like arthritis episodes, years of poor posture from prolonged sitting or standing, or the lingering impact of old injuries. Pancreatic concerns, however, can quietly irritate surrounding nerves and tissues, creating that steady ache that refuses to improve with rest, common pain relievers, physical therapy sessions, or the passage of time. It's comparable to a slow, concealed leak forming behind a wall. You can't see the source, but it's steadily causing harm. Inflammation develops quietly in the background, transmitting those faint, low-grade pain messages that are very simple to overlook. According to data from the Mayo Clinic, which reviewed more than 1,200 patients, about 55% reported experiencing some degree of back or upper abdominal discomfort for up to 6 months, or sometimes considerably longer, before a diagnosis was made. If you've been living with ongoing upper abdominal or mid-back pain that lingers without any obvious cause or relief, consider adding the word alert in your comment below to let me know you're really focused on this section. Another sign that becomes more noticeable, though still subtle in its early stages, is jaundice. This appears as a yellow discoloration of the skin or the whites of the eyes, often along with unusually dark urine or pale, clay-like stools. It happens when a tumor growing in the pancreas begins to press against or obstruct the nearby bile duct, interfering with the normal flow of bile, the digestive fluid essential for processing fats. Bile functions like a consistent river, transporting vital digestive substances from the liver and gallbladder. Any major blockage leads to a buildup, resulting in that distinctive yellow hue in the skin and eyes, plus itching and clear changes in digestion and stool color. Research from the Cleveland Clinic indicates that in roughly 65% of cases caught relatively early, jaundice tends to emerge after other milder symptoms have already started, so its appearance is a powerful prompt for immediate and thorough medical assessment. If you spot this kind of change, please don't delay in seeking help. Because the pancreas is so central to controlling insulin and maintaining balanced blood sugar, any decline in its performance can lead to unpredictable glucose levels. This can show up as brand new diabetes developing after the age of 50, or as sudden challenges in controlling blood sugar for someone whose diabetes had previously been stable and well managed. Insulin works like a key that opens cell doors, allowing glucose from the blood to enter cells and provide energy. When insulin production decreases, becomes inconsistent, or is otherwise compromised, sugar remains in the bloodstream, depleting energy stores and frequently causing heightened fatigue. An important study in the journal Diabetes Care looked at 750 adults who had sudden shifts in their diabetes condition and discovered that approximately 5% of them were later found to have early-stage pancreatic cancer, a proportion much higher than expected in the broader population. The biggest mistake people tend to make is looking at these symptoms separately instead of as a group. Unexplained weight loss on its own might reasonably be attributed to aging or lower appetite. Back pain by itself could easily stem from posture issues or muscle problems. Newly emerging or worsening diabetes might seem tied purely to genetics or lifestyle factors, but when 2, 3, or more of these signs start appearing together, the combination turns into a serious indicator that deserves prompt investigation. To make this more concrete, let me share a couple of actual patient stories that show exactly how these patterns unfold in real life. First, consider Margaret, who was 68 years old at the time. She had always maintained excellent health, stayed very active, and lived independently. She walked every day, tended her garden, and spent joyful time with her grandchildren. Then, within just 3 months, she lost 12 pounds without trying to do so. Around the same time, she developed a dull, nagging ache in her upper back that stretching or rest couldn't relieve, and she started feeling unusually full after eating only small amounts of food she normally loved. When she came to see me, she felt puzzled and a little anxious, saying, "Nothing about my daily routine or eating habits has changed at all." We promptly put the early protocol into action, closely tracking her symptoms for a brief period, running essential blood tests quickly, ordering the right imaging, and providing targeted nutritional guidance. The blood work showed elevated liver enzymes, and subsequent imaging detected a small lesion on the pancreas. Because we identified it at a relatively early point, she was able to have surgery with positive outcomes. In the months that followed, she gradually regained 8 pounds, her energy levels came back, and she later told me, "I truly feel like my old self again. I'm so grateful we caught this before it progressed any further." Next, there was Robert, age 72, who had managed stable type 2 diabetes successfully for 15 years through medication and steady habits. Over a 6-month period, however, his blood sugar readings began fluctuating dramatically, even though his routine stayed the same. His stools turned pale, oily, and hard to flush away, and he experienced deep fatigue no matter how much sleep he got. At first, he was reluctant to mention it, assuming it was simply aging or possibly a medication effect. When he finally brought it up, we applied the early protocol to piece everything together. Testing showed evidence of obstructive jaundice, and imaging confirmed the presence of a small tumor. With early surgical treatment, his blood sugars stabilized, the fatigue lifted, his digestion returned to normal, and his overall quality of life improved significantly. These real-life cases, and the hundreds of similar ones I've seen throughout my career, clearly illustrate how paying attention to subtle, combined patterns early on can lead to dramatically better results. Now let's get to the precise protocol I use every day in my practice, the early protocol. The name reflects the critical truth that recognizing emerging patterns as early as possible can truly make all the difference. Although it's frequently outlined in 5 main steps, I occasionally expand it to 6 points to stress the importance of being thorough. Step 1 is to track changes with diligence. Develop the routine of checking your weight on a weekly basis, noting your appetite, recording any abdominal or back discomfort, observing fatigue trends, monitoring stool color and texture, and keeping an eye on blood sugar variations if they're relevant to you. Choose a straightforward method, a paper notebook, a phone application, or whatever suits you best, and log the dates, rate the intensity from 1 to 10, and include related notes such as meals eaten or daily activities. Patterns almost invariably provide far more insight than isolated symptoms alone. Mayo Clinic research shows that regular, consistent tracking can boost detection accuracy by up to 40% when the information is shared with a doctor. Always bring your journal to medical appointments. Be precise in your descriptions. Rather than vaguely saying, "I've lost a bit of weight," explain, "I've dropped 10 pounds over 3 months, I get full very quickly after starting meals, and I've seen pale stools recently." That kind of detail encourages the appropriate follow-up tests, including liver function blood panels, bilirubin measurements, or specialized imaging. Step 2 is to tackle modifiable risk factors proactively. If you smoke, commit to quitting. Work toward maintaining a healthy weight with balanced nutrition. Keep alcohol consumption moderate. And if you have diabetes or prediabetes, strive to manage it effectively. Cleveland Clinic data indicates that these kinds of lifestyle modifications can lower the risk of progression by 20% to 30% for those who may be at higher vulnerability. Focus on including more fiber-rich foods, lean sources of protein, and beneficial fats to promote healthy digestion and steady insulin function. Step 3 is to ask for the right tests. Once patterns become evident, begin with standard blood tests to evaluate liver enzymes, bilirubin, and, if appropriate, tumor markers such as CA19-9. Then proceed to imaging options like an abdominal ultrasound, a CT scan using a pancreatic-specific protocol, or an MRI to get a direct look at the pancreas. Paying close attention to those quiet whispers grants you real control, clearer understanding, and broader possibilities for the future. If this content spoke to you and provided value, please consider subscribing for additional discussions. Next week, we'll explore lesser-known indicators of liver issues in older adults, including one that often catches people by surprise when they first learn about it. Another important sign that frequently goes unnoticed is a clear reduction in appetite or the feeling of becoming full surprisingly fast after beginning to eat. It develops gradually. You might consume just a few bites and suddenly feel completely stuffed, as though you'd eaten an entire meal. Foods you once enjoyed may no longer seem appealing at all. Some individuals notice mild nausea without vomiting, while others simply lose any real desire to eat. Although a modest decline in appetite can happen as part of normal aging, perhaps from a slower metabolism or alterations in taste and smell, fresh, ongoing, and unexplained changes of this type should be taken seriously. Pancreatic problems can hinder digestion overall and generate pressure in the abdomen that slows stomach emptying, contributing to malnutrition and additional weight loss despite not deliberately skipping meals. Whenever a patient says to me, "I just don't have any interest in food anymore," I dig deeper. How long has this persisted? What other shifts have occurred at the same time? Closely connected are alterations in bowel habits, subjects many find awkward to mention, so they often get minimized or ignored. Stools can turn unusually pale, oily, large, or difficult to flush away entirely. Alternatively, there may be new ongoing constipation, odd consistency, or stools that float more than usual. These shifts commonly result from decreased delivery of bile or enzymes to the intestines. Undigested fats lead to oily, strong-smelling floating stools. This can happen even without obvious jaundice. A lot of older adults blame these changes on recent dietary adjustments or medications, but when they're recent and without clear reason, they deserve candid discussion with a healthcare professional. Unexplained fatigue or overall weakness is yet another clue that's simple to disregard. Feeling tired grows more frequent with age, linked to changes in sleep quality, less physical movement, or built-up chronic conditions. But a persistent, exhausting tiredness that lingers even after sufficient rest, or a marked drop in endurance for everyday activities that once felt routine, is distinct. The body quietly redirects energy to combat concealed issues. Profound fatigue can act as an initial warning. By itself, it's seldom an urgent red flag, but combined with weight loss, appetite shifts, or pain, its importance increases substantially. A sign discussed less often but worth noting is unexplained blood clots. These might present as abrupt swelling, redness, warmth, or pain in a leg, typically the calf or thigh. If a clot moves to the lungs, it can trigger sudden shortness of breath, chest discomfort, dizziness, or a rapid heartbeat. Some cancers, pancreatic cancer included, can quietly influence the body's clotting processes, elevating risk even absent common causes like prolonged immobility or recent surgery. Occasionally, these clots serve as the first hint discovered during evaluation. Blood clots arise from various sources, but unexplained occurrences in this setting call for more thorough examination. The true strength comes from identifying clusters of symptoms rather than isolated ones. Reduced appetite paired with unintentional weight loss, bowel changes occurring with jaundice, ongoing fatigue alongside dull pain, or newly diagnosed diabetes together with digestive irregularities. A single symptom might easily be harmless or age-related, but when several emerge concurrently, concern rises considerably. The body often transmits grouped signals when a significant issue is developing underneath. Too many older adults remain quiet about these developments due to various fears. Fear of seeming overly concerned, fear of being seen as overly anxious, or fear of potential findings. Yet speaking out represents real courage and self-responsibility. Presenting a collection of symptoms to your doctor supplies vital context and information that directs suitable testing. Be straightforward and specific rather than overly emotional. Describe how long symptoms have lasted, how they've changed over time, and the complete picture. This precision assists in assessing priority and planning next actions. Blood work can assess liver function, markers of inflammation, or additional indicators. Imaging offers direct visualization of the pancreas and adjacent areas. When indicated, specialist consultation may be arranged. The aim is collecting facts, not leaping to conclusions. Steps focused on prevention also hold real value. Completely avoiding tobacco, sustaining a healthy weight, effectively controlling diabetes or blood sugar levels, and moderating alcohol use. If pancreatic cancer or related conditions run in your family, disclose that information openly to your healthcare team. It carries weight. These actions don't remove all risk, but they substantially enhance chances and bolster general strength. My core recommendation is straightforward. Stay alert to ongoing, unexplained alterations. Resist the instinct to label every new change as simply aging. While aging does introduce gradual, expected adjustments, it rarely produces abrupt or grouped unexplained patterns. Your body continually communicates, frequently through soft whispers. Learning to hear them attentively and responding early preserves control and choices. If any of these descriptions sound familiar, move forward, contact your doctor, prepare notes ahead of time, and think about bringing a loved one or friend along for added support and precision. Taking action produces the clearest answers, not fearful assumptions. Awareness lays the groundwork for action, and action creates pathways to improved results. Please share this information with someone over 60 whom you care about. It has the real potential to make a meaningful impact, possibly even a life-changing one. Discussions on these subjects may feel slightly uncomfortable initially, but they're incredibly important. Tracking sites at the center of the approach. Rely on a journal or app to record weight, appetite, digestive patterns, fatigue intensity, blood sugar readings when applicable. Document when changes began, how they develop, and any patterns that surface. Carry those details to doctor visits. Your personal observations frequently prove essential for detecting subtle developments that might otherwise escape notice. Regularly review your current medications as well. Certain ones can cause digestive side effects or affect blood sugar, so separating those influences from possible warning signs is useful. Engage your support system. Family or caregivers often spot shifts you might overlook. Having someone join you at appointments helps ensure key details aren't missed and brings an extra viewpoint. This all-encompassing strategy, continuous observation, deliberate lifestyle decisions, nourishing balanced eating, adequate hydration, moderate exercise, mindfulness of stress and rest, supervised supplements when suitable, and close collaboration with healthcare providers, strengthens pancreatic health and general wellness in significant ways. Absolute guarantees don't exist naturally, but these practices shift the odds favorably and prepare you for the quickest, most effective response should concerns arise. Spotting these indicators isn't meant to create fear. It's truly about empowerment through accurate knowledge and realistic actions. Continue watching for unexplained weight loss, appetite alterations, persistent fatigue, digestive irregularities, and emerging or changing diabetes. Respond with steady monitoring, positive lifestyle practices, and timely professional assessment to support the healthiest possible later years. Pancreatic cancer exemplifies how grave conditions can start with extreme subtlety, through hints so faint they're easy to miss. We tend to think it hits suddenly and dramatically, but typically it unfolds slowly, showing itself via understated clusters of signs. When those clusters form, resist minimizing or ignoring them. Your body sends messages without pause. Mastering the skill of listening closely matters greatly. Acting early isn't assuming catastrophe. It's smart preparation that keeps options open. Blend strong awareness with tangible steps to claim greater influence over your health. Spread this message far and wide. It holds the capacity to change lives. Empower yourself and your loved ones. Transform those quiet whispers into unmistakable, timely cues that lead to stronger outcomes and deeper peace of mind.